Did you know that there is an estimated 20% of the U.S. population that has some sort of thyroid disorder? 60% of those who have a thyroid condition are usually unaware of that. They kind of put off the symptoms, such as being tired and headaches. Women are 5 to 8 times more likely than men to have this condition. 1 out of 8 women will develop a thyroid disease. Most thyroid diseases are lifelong conditions that are carefully managed by medication and monitored frequently by a physician. This can be a genetic disease. I know from personal experience. I have a thyroid disorder. I have hypothyroidism, which means it's underactive, so I don't produce enough hormones. But it is easy to keep it maintained and stabilized by medication. Your thyroid is a small butterfly-shaped gland that's usually at the bottom of your throat. Kind of like this picture here, if everybody can see it. Thyroid hormones make all of your organs function properly. Your hormones affect your metabolism rate, which means how fast or slow your organs work. These levels are very sensitive, and this is why you may have symptoms such as being really tired or irritable in my case. There are 2 types of thyroid disease: hyperthyroidism, which is where your gland produces too much hormones. Most of the time, ones who have hyperthyroidism have difficulties gaining weight, whereas people with hypothyroidism who make too little hormones have trouble losing the weight, and they tend to gain more than people who have hyper. Some people who are affected by this disease may know that they have this condition, but may not know what caused them to have this disease. There are many different causes, but there are 4 common ones. The first one is Graves' disease, which is the production of too many hormones. Toxic adenomas are nodules that develop in the thyroid gland, causing a chemical imbalance. Subacute thyroiditis, which is the inflammation of the thyroid gland itself, which in the end can cause the thyroid gland to leak excessive hormones. Malfunctions of the pituitary gland. This gland tells the thyroid how much hormones to produce, as well as it can cause cancerous growths on the gland. Most people don't realize all the side effects that come along with having a thyroid condition, depending on which type you have, hypo or hyper. You can have significant weight gain or weight loss. Another one is pregnancy complications. It does increase your rate of having multiple miscarriages due to your hormones not being stabilized, because when you do get pregnant, it kind of throws off your hormones. Lack of thyroid hormones in a newborn can cause dwarfism and mental retardation if it's not caught soon enough. Also, depending on what type of thyroid, you can be really tired, and you can have hair loss as well. It may seem like having a thyroid condition is bad, but as long as your doctor carefully monitors your levels and keeps them stable, then everything should be fine, and you can go back to your normal activities. Today, thyroid disease is more common, but it is kept under better control with all of the new technology. I have, like I said, an overactive thyroid, but it's also a lingual thyroid. It never moved down to the bottom of your throat where it's supposed to be. Mine's still underneath my tongue, so that's why mine doesn't work properly. I personally know how important it is to keep the hormones regulated and to take my medication daily for the rest of my life. 1 in 5 people have a thyroid condition, so the next time that you're out in the mall, just think one of those 5 citizens most likely have a thyroid condition.
Good. I have a question.
Hey.
When you have that lingual, like you have, can you see it? Is your thyroid visible under your
I
tongue?
don't want any sugar
Or do
in
you
my
have to
house.
have a microscope or whatever to see it?
Only if you look at it.
You have to have a microscope to look at it, unless you have a goiter, which they usually stick. They protrude a lot.
My mama had one that was down here.
Yep.
It was too low. She had to go to Baltimore and had it took out. It was in the 50s.
Yeah, you can have them taken out. A lot of people do. Just depends on what all is going on.
I have a question. Is there a cure for the disease?
Yes, if you have hyper or hypo, they have medication called Thyroid, and usually, in my case, I have to take it every day for the rest of my life. It just regulates it.
Okay, does a lot of people have to have surgery for this? Or can you have surgery to get rid
You
of
can
things?
have surgery. Most of the time, they remove them if maybe there's cancerous growth on it, because that can happen sometimes. Or as like he said, a goiter, the ones that protrude, those kind of cause complications.
Oh, okay, so they'd have to have surgery,
Mhm.
okay.
Are you studying that? She's studying to be a nurse.
Probably is then.
She will.
Do you think eventually that technology will have a cure for it all?
Maybe, and the way technology's going.
Well, it's medicated, ain't it? They medicate you for
They're
it.
medicated, yes.
Because you can have thyroid trouble and live for years and years.
Yeah.
North Meadows had it for years.
Yeah, you got it.
Huh.
That's the reason you don't gain